ELI5 by life cannabis at times. ELI5, why isn't more antibiotics injected rather than oral? Not really, because if you inject something it goes into your blood, and blood goes everywhere. But giving antibiotics orally is very much less invasive than IVF treatments are not invasive, then patients are more likely to take them. To put in other words, ease of application. It is way easier to get someone to take a pill every day than it is to get them to come in for an IV or give themselves a shot every day. The injection is more complicated, you need some training to do it correctly, and there is also the risk of infection. Most antibiotics are taken at home by the one with the infection that likely has no medical training. Swallowing a pill is simpler. Injection yourself or having someone else do it is not simple, it requires training to do it in a safe way. The result is there are very few medical interventions that are done at home that require injection. If there is a requirement, there is some training involved. So injected antibiotics are used in a hospital setting if the oral variant is not appropriate. There you have trained people that can handle it. I have to change my ELI5 for her because she can't afford a hospice, and I'm certainly not professionally trained nor qualified lol, but there are procedures that require at-home injections. Because injections need to be performed by medical professionals and that would require people to make a lot of trips to hospitals or GPs, and it would put a huge strain on those facilities. Also, the more effort it takes to do something, the higher the odds people will quit doing it before it's safe to quit. And X200B. Purely from a medical standpoint it's a good idea. But it's not practical in the real world. That is not how antibiotics work. Well, at least not how all of them do. If you have a pneumonia, infection of the lungs, you will still get the antibiotics IV, intravenous, or PO. Oral, because the active substances go through the bloodstream to the bacteria. If you have an infection of the gastrointestinal system you will most likely receive antibiotics PO, and if you are lucky and your type of bacteria is susceptible to non-absorbable antibiotics then you will get one of those. For example, C. difficile can be treated with vancomycin, which does not get absorbed from your intestines and works only inside the gastrointestinal tract. This will help you not get problems with the bacteria in your skin and mucosa causing mycosis, infections with fungus. To sum it up, it does not matter how you give the antibiotic, almost never, an exception I have mentioned, it will sadly almost every single time destroy the good bacteria reaching it through the bloodstream. And X200B. Side note, there are other options nowadays and we are trying to use local antibiotics. For pneumonia we can also do inhalative therapy. For urinary infections we have some antibiotics that get excreted in urine, and for other types of incisions, skin, eyes, we have drops or ointments. There are plenty of injected antibiotics and they wreck your gut health just as bad as oral antibiotics. Antibiotic drugs need to be present in the body at specific levels in order to effectively manage the bacteria that are causing an infection. This level is called the minimum inhibitory concentration, MIC, and is different for each antibiotic. Regardless of how the drug is administered, an antibiotic will enter the bloodstream and be distributed throughout the body before being eliminated, mostly via the liver and kidneys. These processes, called pharmacokinetics, are also different for each antibiotic. An infection is treated by ensuring that the right amount of antibiotic is present in the body for the right amount of time. Typically, repeat antibiotic doses are required every 8, 12 or 24 hours for 7 or more days. We know that many antibiotics are absorbed very well into the bloodstream from the gut and they are generally well tolerated by patients when administered orally. Regardless of route of administration there will be an impact on the gut biome. However, not all of the normal flora will be destroyed. Plus, we can utilize probiotics and prebiotics to support the biome. Ultimately, it boils down to convenience of dosing and ease of administration for patients. Self-injection would require training. skill and correct storage of the drug to ensure effectiveness. Multiple injections would be required daily, and injections are more invasive than taking a tablet. Antibiotics for injection typically come in larger volumes than would be required by a single patient for a single course of treatment, so it's less cost effective. From experiment on myself, if you take antibiotics orally, each time you take it, take a probiotic about 2 hours later. That gives the antibiotic time to move on from where it's killing everything, which will let the probiotic replace the population and avoid a fungal microbe explosion, which is what causes the bloating and other issues from antibiotics. Doctor here. A lot of antibiotics we give are an injection and through an IV. They are systemic and still affect your digestive tract, and there is still risk for diarrhea and even overgrowth of bad bacteria like Clostridium difficile. Probably be a bit less convenient if the treatment lasts for 5-7 days or longer, and having to get that person into a setting to make the injection daily, or twice daily. Doable but rather impractical for most people. If there is a serious infection, like blood sepsis, then the patient will be hospitalized and IV antibiotics given. Injections are invasive, that is, they break through the body's outer defense, so they're high risk. Yeah, maybe it's just a tiny little hole, but it's deep. Injections are high risk when not done properly. Here are some: NSFL45 and AMP, B equals 886 and AMP, DPR equals 1.1, of injections gone wrong. Dirty needles etc. If you keep livestock, most antibiotics are injected. But it's not like one injection and you're done. It's usually either RAM injection 2x day for a week or subq injection every other day for a week. I have to assume that your answer lies in that fact. It is rare for doctors to prescribe medicines for home use that have to be administered by injection, especially when oral administration works just fine. I am not sure if that is more because patients are not comfortable administering injections, or because the medical industry as a whole does not trust patients to do it. I will say that when you administer an antibiotic injection to an animal, it very clearly hurts like a motherfucker. I usually do it in the shoulder, and the animal will cry and often stumble for a few steps when they try to walk. A lot of people are huge babies about injections anyway. Can you imagine if you had to get several shots like that every time you get sick? Disclaimer, not an expert. Injection tends to be easier on the body overall, because among other reasons direct delivery into the bloodstream means a lower dose is sufficient to reach the target concentration of the drug than you'd need with a less efficient delivery method like oral. But oral has two big advantages. The first one is convenience. It's just easier to take a pill twice a day than get an injection twice a day, especially if side effects make getting around difficult or if you're infectious and shouldn't meet people. The second is retardation. It's somewhat easy to basically program a pill to give off its drug at a predetermined point section of your digestive tract, or even have several stages, at a certain rate. Injection, as far as I'm aware, means you get the whole dose of the drug at once, which means drug concentration in your body peaks and then continually goes down, where a pill can give off the drug slowly over a long time, keeping the concentration somewhat stable. I had to give my mom IV antibiotics for a week or so when I was 22. I will never forget it. Way so much trouble. She needed the line insert all the time. Then I had to hook up a tube once or twice a day with the drip. And I had to make sure there were no bubbles in the tube. It was so scary. She was a good patient. But what about a kid who will run around? Oh no. Besides all the reasons given above, neither the healthcare system nor the feds want you to be able to have needles at home. Diabetes and a few other conditions really do require them, but drug addicts need needles all the time, and the last thing the anti-drug establishment wants is for everybody to have a few dozen leftover needles lying around their homes. Not a doctor, but I assume the antibiotics people take target certain receptors on the bacteria they are trying to kill. Those receptors probably aren't present in gut bacteria, basically making the meds oblivious to our good bacteria. Everybody wants to inject when possible, but a lot of the time, you just gotta settle for oral. But in seriousness, so that people can do regimens at home easily. Many people hate needles, many would have trouble injecting, mess it up. Pills are just easy. Because people aren't going to give themselves shots and pay for all the needles, disposing them.